Are you struggling with tired eyes or hollowing around your eyes or maybe dark circles? Well, if you want to know what you can do about it and what's causing it, make sure you watch this video and like and subscribe below. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and today I'm going to talk to you all about what's causing those dark circles under your eyes. So really we can break it down into different factors. Dark circles or the look of tired eyes aren't caused by just one thing. There could be a variety of factors going on, and it's important to know exactly what is happening around our eyes so we can get to the bottom of it. All right, let's get into it. Number one, is it pigment? There can be pigment that develops around the eyes. Often in my patients with darker skin types or mixed ethnicities, we do notice some darkening developing around the eyes, and that could be something that runs in the family. It's not necessarily anything you're doing. But what can you do to prevent that? So when a patient comes in and they're concerned about dark circles under the eyes, the first thing I do is get up real close and assess what's going on, what's contributing to the dark circles. And if you stretch the skin, you can see little brown spots that could be contributing, which means that there's pigment under the eyes. Like I said, this could be inherited, and most often it's a genetic sort of trait, but there are things that you can do to prevent this. This can be inherited, but it can also be due to a few things that are preventable. So if you suffer from irritation around the eyes, that's a good reason to check in with a dermatologist to see what the root cause of that irritation is. Consistent rubbing and irritation around the eyes can lead to what we call post-inflammatory hyperpigmentation, which is basically darkening of the skin around the eyes due to constant rubbing. Many things can cause irritation around the eyes, and we in dermatology call it eyelid dermatitis. The number one culprit, though, is usually allergies. So if it's spring or fall and you're prone to allergies, it's a good time to start preventing those allergic type symptoms by taking antihistamines on a daily basis. Something like 10 milligrams of Zyrtec or 60 milligrams of Allegra every night before bed. This can help with puffiness under the eyes due to allergies, and it can also help with that itchiness, which is what's causing you to rub. And therefore, if you stop rubbing, we can prevent the development of dark circles on one hand. On the other hand, there can be a genetic predisposition to dark circles under the eyes, which can be curbed but maybe not completely eliminated. So we can do this by using under eye creams that contain retinols, which help with cell turnover, and also lightening ingredients like kojic acid, niacinamide, arbutin, soy extract. That's just to name a few. But make sure when you're looking for an eye cream that will help with brightening and lightening of the pigment, you look for something that's specifically formulated for eyes. All too often, I hear that people are using the creams that they're using on their face under their eyes and then developing irritation. Eye cream should be distinctly different from your face cream, and that's because it's dermatologically tested to be safe around the eyes. Also, the molecule size might be different, the formulation might be a little lighter, so that it can really penetrate into that gentle under eyelid skin. Lastly, for pigment around the eyes, we can do in-office procedures like chemical peels and lasers. So if all else has failed and you've tried the antihistamines, you're not rubbing, and you've tried an eye cream that helps with lightening, that's gentle enough for around your eyes, and you still need some help, then you can talk to your local board-certified dermatologist about procedures that might help for lightening around the eyes. The second cause of dark circles or tired-looking eyes might actually be blood vessels. Yes, there are so many blood vessels around our eyes, as you can imagine. Our eyes need to be supplied with all the nutrients from our blood flowing to ensure that we can see and our eyes themselves stay healthy. So there are a lot of blood vessels around the eyes, but often they can lie superficially under the surface of this very thin skin and actually be very visible. So I'm sure many of you have looked closely in the mirror and sort of spread the tissue under the eye and notice that you see some purple vessels running through the eye. Fortunately, there is a treatment for these under eye vessels. It should be an in-office procedure only, done by a board-certified dermatologist, plastic surgeon, or ophthalmologist, somebody who is trained in using lasers around the eyes. We can use lasers to help collapse these blood vessels so that that purple red hue is not as visible anymore. But I would caution you, I wouldn't go to your local med spa or some spa across the street that says they laser under the eyes, because this is a very dangerous area to be using lasers, and the operator needs to be properly trained, certified, And if ever you're getting a laser on the eye, make sure that they place eye shields inside your eyeballs before using a laser to protect your eyes from the laser beam itself. The next cause of tired eyes or hollowed eyes or dark circles around the eyes could actually be due to the natural aging process. So as we age, we stop producing as much collagen as early as our late 20s. And collagen, as you know, creates a lot of the structure of the tissue in our body and especially on our face. So between your eye and your bone, there's something called the orbital septum. And that's an area that's created by collagen that actually holds back some fatty tissue that is used to kind of cushion the eyeball. So over time, the collagen that creates your orbital septum actually weakens, and the fatty tissue that lives behind the eye can actually start to protrude forward through the weakened septal barrier. What that looks like visibly on the skin are bags under the eyes. The bags are actually fatty tissue that's penetrated through the orbital septum and gone to a superficial landing plane to where you see it now. So when you have bags under your eyes, the number one thing to remember is it's nothing you did wrong. This is something that comes with the natural process of aging and also can be an inherited trait. So you'll find that your parents or maybe a sister or an aunt or somebody in the family also has bags under the eyes, which are actually made of this fatty type tissue. So there are a few ways to address the protrusion of fat through the orbital septum, and that includes surgery. So that's the most invasive and most dramatic result. So you'd see a board-certified oculoplastic surgeon who has special and extra training to do surgery like this around the eye. The procedure is called a lower blepharoplasty. And what they do is they help eliminate that pocket of fat that has protruded through the orbital septum and then smooth out the tissue under the eye so that fat pocket is gone. Now that's a surgical procedure and it can be done in many different settings, so there is some recovery involved, and you might be young and not really thinking about surgery. So another option would be to see a board-certified dermatologist or plastic surgeon or oculoplastic surgeon to do some filler in that area. Now the filler has to be placed very strategically, because if you're trying to lift tissue to sort of meet a bulge, you could end up looking puffy and fake and unnatural. So that could be a temporary fix, but it's not my go-to for this area in the long term. Other than that, eye creams containing caffeine and green tea extract can sometimes reduce that look of puffiness temporarily, and so it'd be good to use them twice a day to help to see if that helps improve the appearance of that puffiness, which is caused again by fat protruding through the orbital septum under the eye. Along the same lines as dealing with the aging process, you can also suffer from hollowing under the eye. This hollowing in medical terms is called a tear trough, and that is also due to the way that our fat pads have shifted in our face and the way that some ligaments on our face separate different anatomical parts to the face. And so you can get this hollowing or tear trough under the eye, which is often due to movement of fat pads in the cheek. And so if you notice that trough or that hollowing right here under the eye, filler is actually a really nice option for that area. Again, making sure that the filler is done by a board-certified physician who knows what they're doing. This is an area rich with blood vessels, as we've talked about, and can be dangerous if done by an unexperienced provider. One thing to note about filler, if you're considering filler under the eyes, it is a high bruise-prone area. So before you get filler, it might be important to think about avoiding things that cause you to bleed very easily. So if you take an aspirin a day just by choice, or if you take ibuprofen for headaches or muscle pains, it might be a good idea to avoid it the day before you're going to get filler, especially under the eyes. Some things that you can do to help speed up the bruising process are to apply an arnica-based cream in that area, or take arnica or bromelain, which is pineapple extract supplements, or make sure you call your injector, and if they're a dermatologist and know how to use their pulse dye laser, a few pulses with the pulse dye laser can actually help speed up that bruising process. Lastly, you might just have crepey loose skin in the area. Oftentimes people will come into my office and say, "Oh, I feel like I'm aging, I feel so old, so tired," and I see it in pictures. And what they're seeing is crepey skin, so change in the texture to the skin under the eye. And also they might be seeing crow's feet, which are lines that form around the eye from our natural expression. So when we smile and talk and you are expressing, you're constantly folding the skin in that muscular area around the eye, which can often lead to etch lines or crow's feet and also crepey skin. So what do we do about crepey skin? Well, I've talked about eye cream before, and so that's a very good place to start. Use eye creams that are especially hydrating. So you want to look for ingredients like hyaluronic acid that helps to hydrate the skin, and ceramides that help to replenish that moisture barrier, because often crepey skin can form just from having dry skin under the eyes. There are also a lot of great hyaluronic acid serums out there that you can use around the orbit in its entirety, and that'll help prevent the development of those etch lines from constant expression, which is natural and something we should all be doing, smiling every day. The more definitive way to prevent these etch lines from forming is actually by getting Botox or neuromodulators. In our office, we use Dysport and Xeomin. They're all very similar in how they act, but essentially they prevent the muscle from talking to the nerve. And so when you want to smile, you won't be able to make that expression as aggressively. It's not that you won't be able to smile or your smile will look weird, but the muscle around your eye won't contract as much as it normally would because you've been treated with neuromodulators. A little bit of neuromodulator around the eye, even once or twice a year, can help slow the development or entirely prevent the development, if you do it regularly, of those crow's feet around the eye. Now, under the eye, you can also put a little neuromodulator under the eye. Remember, we're talking about Botox, Dysport, Xeomin. Put a little injection under the eye to help with that eyelid creasing and even that jelly roll that develops in some individuals. You can put a little neuromodulator under the eye as well to help with that crepey skin texture and also prevent that jelly roll that develops in some individuals, leading to that puffiness under the eye. A more definitive treatment for under eye crepey skin is actually a resurfacing laser. Now, it doesn't have to be scary or give you a lot of downtime, but we use a laser called the Clear and Brilliant, which is a low level, low energy, non-ablative fractionated laser, and you can get right up under that eyelid skin. And if you maintain this procedure quarterly, so just 4 times a year, you can help reinforce and stimulate collagen to that skin under the eye. Now, if you're looking for a more dramatic change with that crepey skin, maybe you're a little bit older, you might want to consider a more aggressive procedure like ablative resurfacing with a laser under the eye, which can help essentially create new skin in that area. So there are a lot of procedures that are non-invasive, non-surgical, when combined with neuromodulators here and there, and also really good skincare products that you use at home that can help with that crepey texture under the eye. Well, if you like this information and you learned something and you have some questions, make sure you drop them in the comments below and like and subscribe for more. Thanks so much for watching.